Thank you, Lola Tindu. I will go to the topic straight. Dear friends, this is a concept which is very new, which came in the year 2022 in the month of October. What I'm going to talk today is about a concept which is about the first year treatment matters in type 2 diabetes mellitus. I'm not talking about ordinary early intensification, which all of us know. I mean, we want to do early intensification, but it's the first year treatment which matters. And you know, if you go to the next slide, I have tried to show. You know, it is a very game-changing concept, a life-changing concept. Now, I would like to put it very simply. Please have your attention on these words. The first year after diagnosis is the crucial time in the life of a person with type 2 diabetes mellitus. It is important to have blood glucose control throughout the entire life course of type 2 diabetics. But the new research, which I'll describe, has shown that the first year control can reduce the long-term complications like cardiovascular disease, diabetic kidney disease, diabetic eye disease, and the NAFLD, which Mohan just now referred to. Fortunately, early diagnosis may be the opportunity to intervene, and that's important. And we'll discuss in the question answer, how do we diagnose diabetes early? Next slide, please. And you'll find that you know why it is important. When one gets diagnosed with type 2 diabetes, it is a life-changing moment. And this concept believes that it could be used as an opportunity when you diagnose type 2 diabetes in any individual to change his health behavior. It is a teachable moment. The Leiterprong, who brought this message from University of Chicago, says that this study, which I'll describe to you, shows that the first year is probably the more important than all the other. So it's the best time to make these changes. This study, which is published in Journal of Diabetes Care in 2022, compared early first-year blood sugar control rates to the complications on an average of 13 years. The researchers found that the patients who had H1C values between above 6.5% in the first year were more likely to develop complications. Patients with H1C values above 7% in the first year even had increased risk of early death. This is a new study. The assistant professor and the whole department was thrilled by the research published in the Diabetes Care, which said that if you analyze the health records of more than 34,000 patients that they did, the values of the first year H1C control mattered. You know, H1C is a typical blood sugar control parameter, and it has been described that you have to keep the H1C between 6.5 and 7 as a healthy target. Now, the summary of the paper was very simple. Treating diabetes in the first year is important because it puts the patient's health on a trajectory of good control, of no complications, no propensity to death for the rest of their life. Dear friends, it is not true that one cannot improve one's blood sugar levels later. But if you start early, we have to work much harder. If you are late, you have to work much harder to stay healthy. So if you start late, you have to work harder. Then we start early in the first year. Treating diabetes is important. Long-term blood sugar caused by uncontrolled diabetes, the mediation of the complications are through many things, but the most important today is inflammatory changes at the cellular level. And they occur very early. So faster control matters. And the body produces less insulin and struggles to put the glucose back in the bloodstream to normalcy. This inflammation has to be controlled. Now, it has been said that this inflammatory concept puts the circulatory issues at jeopardy, and one develop microvascular complications in the kidney, eyes, and also macrovascular complications in the heart and the stroke and the peripheral arterial disease. The so-called legacy effect, which chairperson referred to, of controlling blood sugar early can prevent these complications, but the delayed benefits can pose a great problem for the physicians. Dear friends, there is another paper from the same group, which also came in the Journal of Diabetes in 2016, And I would like your attention to this. They said from Chicago that it is difficult on their part to convince the patients to say you take the medication. It will help you years down the road. They wanted immediate result, but the theory was that if you control well today, you will get the results maybe after 10 years. That was the thing going on that time. And it may not show immediate benefit. And it was found in that study, published study, that 40% of type 2 diabetics with hypertension and diabetes said that they were not interested in taking a medication when they were told that it could take up to 10 years before they could get benefit out of it. Therefore, if you talk about legacy effect after 10 years, the takers are less. But this paper says, if you talk about legacy effect immediately after 1 year, the takers are more. Dear friends, I'll just describe to you the state of the nation. More than 1/3 of the diabetes cases are estimated to be resulting from the population growth and aging, which we cannot stop. 28% because of the age-specific prevalence, which we cannot stop, and 32% because of the interaction between the two. Therefore, diabetes is going to stay with us, and our job is to control diabetes. Now, if you look at the main problem posed by type 2 diabetes mellitus, it is high prevalence, delayed diagnosis. So one of the issues of establishing good control, excellent control in the first year is dependent upon the delayed diagnosis. Therefore, dear friends, this paper had a corrigendum that one should try to diagnose this early by taking recourse to screening by biomarkers, which time permitting I'll describe, and to increase the awareness. Now, the management is suboptimal in many places in the beginning. There's a limited healthcare facilities and high cost of the management. And in India, the average H1C, according to ICEM India, was 8.7 to 9.6. When we completed the study, this ICEM India latest study, which said that you see the H1C, it varies between 8.3 to 9.1 and higher. So the H1C are not controlled. Now, we know for certainty that every 1% drop in H1C can reduce long-term diabetes complications. Is given here in various percentages. This year in IDF, you must have heard the president who said, how many times do we have to tell the physicians and remind ourselves? He was keeping himself in the center that to be spoken about this. Therefore, it is important to know that with type 2 diagnosed, already 50% have complication. 50% beta cell function is lost. And 2/3 patients do not achieve target H1C. Majority require polypharmaceutical control. And in the beginning, we do not emphasize that. Therefore, if we have the reactive stepwise treatment, I'll show one slide, and do not match therapy to the individual, then we do a conservative prescription of the anti-diabetic drugs, we reap the consequences of bad control. Reactive stepwise pattern is showed here. You know this. We have seen this from the Campbell many times. Conservative management of glycemia, traditional stepwise matter, diet, exercise, wait for some time, OED, 1 OED, 2 OED, third OED, OED plus basal insulin, OED plus other insulin, multiple daily insulin injections. You see, the H1C remains high for a longer time. Now, drawbacks of the stepwise pattern is even short periods of hyperglycemia. This is the Sarasian Luft, Professor B.B. Tripaঠি's great friend, Sarasian. He sent me to them. Sarasian Luft have shown that even short periods of hyperglycemia increase the risk of complication. Therefore, proactive approach is needed. And this proactive approach is to control the blood glucose very early in the first year. Diet and exercise are beneficial. Lifestyle changes have beneficial outcomes. And that is across the life course of type 2 diabetes mellitus. But we make delay in stepping up from monotherapy to combination therapy. Therefore, dear friends, to my mind, combination therapy, India is a blessed country where the fixed drug combinations are rampant, and it gives you 3 C's: convenience, compliance, and the cost comes down is the order of the day. Therefore, to titrate the monotherapy to maximum may not give the full benefit. It is combination therapy which gives the benefit. Therefore, the early combination approach is what I'm talking about. And this gives the benefit. The potential advantage of the early combination therapy is the earlier achievement of therapeutic goal, reaching 6.5 to 7. Potential reduction side effect of the individual drug by combining 2 drugs in suboptimal dose. Opportunity to combine the oral anti-diabetic drugs with multiple modes of action of different just amino octet. We address various aspects together and potential to delay disease progression. How quickly one should reach H1C target? Now the message is clear. You take 6 months. In the Global Partnership Diabetes paper recommends, in 6 months, we must bring it down to 6.5 to 7. And it also says, up to 3 months, if patients are not at the target H1C 6.5, consider combination therapy or from the very beginning. And therapy not matched to individual is not what we want. We want the therapy matched to individual. We know how to match it by the various groups of drugs we have in our armamentarium. Now, risk of complication increases with H1C. Individuals with high baseline values require particularly urgent and intensive treatment. Monotherapy is difficult to address this question. Now, Global Partnership recommends that initiate combination therapy or insulin immediately for all patients more than 9%. In our latest paper, we have shown 8.4 to 8.6 also you can start combination therapy. Insulin may be at 9. And, inappropriate prescribing of the anti-diabetic drugs is not to be encouraged. We do not prescribe new drugs like gliptins and SGLT2 inhibitors because you're familiar with the traditional agents. I would like to urge the people attending it. The new drugs, the cost has come down. They're very affordable. I call it 4 things. They're affordable, they're appropriate, they're accessible, and they are very, very cost effective today. Therefore, we should not, and they're very, very safe. The concerns about the safety is not justified. We have to have newer drugs in the armamentarium. And where the ideal components for the combination therapy, combining agent A and agent B, the amino octet, I'm saying the various agents that can address the various aspects of it, and how do we combine drugs to address this amino octet. Therefore, dear friends, delays in the treatment intensification with oral anti-diabetic drugs and the risk of macro complications one has to take care of. So time of intensification of OAD therapy, according to guideline, is to produce greater reduction of the H1C and lower the risk of complications. So these results highlight the potential impact of treatment inertia and the importance of timely treatment intensification on the long-term outcome. Dear friends, therefore, it has been rightly said that early aggressive treatment with 2 drugs, if required 3 drugs, are needed, and that can change the complication cascade that is going to happen later. In this 34,000 patients, it was shown that at the end of 13 years, when they analyzed the data, the complications were much lower and pointers towards death also much lower. So, dear friends, I have presented to you a new concept which came in 2022 October, that first year control matters. Thank you very much. I'll take up question during discussion.